please also understand you have what they call psychostimulants, but it's a highly effective, in some cases, I'm not going to tell you in all, it's highly effective for a child, for example, who has ADHD. Now, the question arises, what is better to do? Should we basically give the child the medication? There's no single treatment for any one child. And again, each child's needs, there may be things going on at home. There may be things that happened in the past, etc. A conglomeration of things that it's not just the ADHD, it only exacerbates it. A treatment combining medication and behavioral therapy is probably the best. Just give them the pill. And when I talk about behavioral therapy, I'm also going to add, that basically parents also need to get, you don't want to call it therapy, call it counseling, in terms of what to do, what not to do. But the fact of the matter is that what we need to take into account is that you have individuals who specialize with ADHD. And again, it could be a doctor, it could be a coach, etc. And please understand, it's extremely important to deal with it before the child's self-concept, self-image is shattered. Nobody wants to play with him. Nobody wants to stay with him or to talk to them or to get together with them. No, I'm not inviting him to my birthday party. No way, no way. No, I don't want to go out with them. Is that when we take a look in individuals who have ADHD, you have different severities of it. Let me put it that way. You have some that are, flying off the wall, and you have some that basically are mild, moderate, type of thing. And again, when we take a look at, common symptoms, for example, it's basically, it's a question of lack of attention. But I'm not paying attention. I understand. I'm not paying attention. I'm not going to, it's not going to sink in because I wasn't listening. I wasn't paying attention. As opposed to, the ones that are the hyperactive ones that are very difficult. I'm inattentive. I'm sitting in my chair, my desk, and I'm there, and I'm not bothering anybody, and I'm looking at the whole world and thinking of what's going on. And then you have the hyperactive impulsive, and that the teacher's really upset, and I understand it, but you have to understand it's not something that he wants to do on purpose. And again, so you have a student like that. Hey, speak to the parent. This is what I see. I'm not a doctor, but I think it's worthwhile to go and to see the doctor. Psychologist, doctor, psychiatrist, whatever. The fact of the matter is that it's something that needs to be dealt with. You can't sweep it under the carpet because it's not just a question that the child will not be able to learn or assimilate the information or pay attention to the. It's basically he's going to also lose friends, and we're talking about children for the time being. And even if I just change the channel to adults, when you have adults who basically have ants in their pants, where are you going? Where are you going? What are you talking? Speak slower, etc. And again, it does create problems, issues, whether it's in a marriage, whether it's in a relationship, whether it's among friends. But it's extremely important to take into account that, yes, it's not just for kids, it's for adults.
So with ADHD, there is the comorbidity of learning disabilities, right?
Well, let's put it this way. Question's a very good one, actually. There's often a comorbidity of specific learning disabilities. We're not talking about intellectual handicaps, but in terms of specific learning disabilities, yes. But let's put it this way. Let us say that the ADHD kid gets medication, gets medication so that he is a lot improved in terms of his attention or in his basically, just moving all over the place, etc., his hyperactivity, um, it can be improved if he takes the medication. Um, However, if the child, for example, without, an average child who basically, is dyslexic, let's say, and when we take a look at the child and we take a look at him reading, and again, and on top of it, he has ADHD, he's not going to be able to go down, he's going to look. Sorry, yeah. And again, he's all over the place again. But yes, what you're saying is correct. But is it really, if we treat, and again, it's something to think about. Maybe that child who has ADHD and is dyslexic, I believe that it would be much easier to narrow the gap between where we want the child to be reading and where he is right now, simply because I'm able to be attentive. I'm able to, stick to it for a while. Um, but again, the ADHD needs to be dealt with. And please understand, um, I'm not saying it's not just the medication. It means quite a bit. It's also the accommodations. And as you and I gave, Linda, a list. And by the way, when I do an assessment and it comes out that the child does have ADHD, I always add those sheets at the end for the teachers to understand. Um, and usually it's helpful. You have some teachers that have been teaching for the last 200 years. It's, oh, I know all about that type of thing. But again, it's something that needs to be looked at and not taken for granted. Out, make accommodations.
That's what you said, because a pill does not replace a skill. And the number one defense that we have for our children are us.
Yep.
Being able to understand, first getting them diagnosed, but being able to understand, being able to accept, being able to hold a place for them, knowing that they have difficulty with frustrations, with transitions,
And
and
empathize.
empathize, accept them, empathize, be curious. Instead of telling them what to do, wow, I'm wondering why, you're feeling this way or why you're doing that. That makes sense to me. It's a different kind of parenting that we do rather than the
Definitely.
accusatory. And the time ins, not the time outs, which is so important. It's all about attachment.
Diagnosis that I call the spot on the shirt syndrome. Hey, the shirt is clean. And this is not just for the ADHD. The shirt is clean. Yeah, he's got a fault. Don't blow it out of proportion. And if you do, for example, point out what he did wrong, and only what you do, what the parent does or the teacher does, what they do wrong, no. Compliment them. Because with some people who are very, very sensitive, that's all. That's all I hear. You did this wrong. You did this wrong. You did. Hey, but I did these right. Yeah, but these you did wrong. Sometimes parents, not really consciously, but they do it, and they just, they don't give the compliments when it's due. And
Because
it's
even
true.
in difficult moments, our kids are always doing something right. And we need to become detectives and find out and look at all the wonderful things that they're doing every single day. Thank you for being here tonight.